Did you know that over 1 billion people worldwide don't get enough vitamin D? This essential nutrient is like a superhero for your body. It keeps your bones strong, your immune system healthy, and even helps your mood stay balanced. But here's the scary part. Many people don't even realize they're deficient until it starts affecting their health. In this video, we're diving into 9 warning signs that could mean your body is running low on vitamin D. These symptoms might seem small at first, like feeling tired all the time or getting sick more often, but they can add up and lead to bigger problems if ignored. Once you know the signs, you can take steps to fix it and feel your best again. So, if you've ever wondered why you're always exhausted, why your muscles ache, or why you just don't feel like yourself, stick around. By the end of this video, you'll know exactly what to look for and what to do about it. Don't forget to hit that subscribe button and turn on notifications so you never miss out on tips to keep your health on track. Let's get started. Sign 1. Constant fatigue and tiredness. Do you always feel tired no matter how much sleep you get? This could be a sign that your body is lacking vitamin D. Vitamin D plays a key role in turning the food you eat into energy. And when levels are low, your energy can take a nosedive. Studies have shown that people with low vitamin D often report feeling exhausted, even after a full night's rest. For example, one study found that women who felt extremely tired had significantly lower vitamin D levels compared to those who didn't. Another study linked low vitamin D to chronic fatigue syndrome, a condition where people feel drained for months. If you're constantly dragging yourself through the day, it's worth considering whether vitamin D could be the culprit. Of course, fatigue can be caused by many things, like stress or poor sleep habits. But if you've ruled those out and still feel wiped, a vitamin D deficiency might be to blame. Boosting your vitamin D levels could help you feel more energized and ready to tackle your day. But first, you'll need to get your levels checked by a doctor to know for sure. Stick around to learn more warning signs. You might be surprised by what you discover. Sign 2. Frequent illness or weak immune system. Do you catch every cold, flu, or bug that's going around? Your immune system might be trying to tell you something, specifically that you're low on vitamin D. Vitamin D is like a shield for your body, helping your immune system fight off viruses and bacteria. When levels are too low, your defenses can weaken, making you more prone to infections. Research shows that people with low vitamin D levels are more likely to get sick often. For example, one study found that individuals with lower vitamin D were more likely to develop respiratory infections like the common cold. Another study linked deficiency to a higher risk of autoimmune diseases, where the immune system mistakenly attacks the body. If you're constantly battling colds, flu, or other infections, it's worth checking your vitamin D levels. While other factors like stress or poor diet can also weaken your immune system, vitamin D is a key player in keeping it strong. The good news: boosting your vitamin D intake, whether through sunlight, food, or supplements, can help strengthen your immune system and reduce your risk of getting sick. But first, talk to your doctor to see if a deficiency might be behind your frequent illnesses. Stay tuned for more warning signs. You won't want to miss them. Sign 3. Bone and back pain. Do you often feel aches in your bones or lower back? This could be your body's way of telling you it needs more vitamin D. Vitamin D is crucial for helping your body absorb calcium, the mineral that keeps your bones strong and healthy. Without enough vitamin D, your bones can become weak and painful over time. Studies have shown a strong link between low vitamin D levels and chronic bone pain, especially in the lower back. For example, one study found that people with vitamin D deficiency were nearly twice as likely to experience bone pain compared to those with normal levels. Another study suggested that low vitamin D could contribute to conditions like osteoporosis, where bones become brittle and prone to fractures. If you're dealing with persistent bone or back pain, especially if it doesn't improve with rest or treatment, it's worth checking your vitamin D levels. While pain can have many causes, a deficiency could be making it worse or even causing it. The good news: getting enough vitamin D can help strengthen your bones and reduce pain over time. But first, you'll need to confirm your levels with a simple blood test. Stick around to learn more signs of vitamin D deficiency. Your body might be sending you more signals than you realize. Sign 4. Depression or mood swings. Feeling down, irritable, or just not like yourself. Your mood might be linked to your vitamin D levels. Vitamin D isn't just important for your bones, it also plays a big role in your brain health. It helps your brain produce serotonin, often called the feel-good hormone, which keeps your mood stable and balanced. When vitamin D levels are low, serotonin production can drop, leading to feelings of sadness, anxiety, or even depression. Research has shown a strong connection between low vitamin D and mood disorders. For example, one study found that people with depression often had lower vitamin D levels compared to those without depression. Another study suggested that supplementing with vitamin D could help improve symptoms of seasonal affective disorder, SAD, a type of depression that happens during darker, colder months. If you've been feeling unusually down, anxious, or moody, it's worth considering whether vitamin D could be a factor. While mood swings and depression can have many causes, a deficiency might be making things worse. Boosting your vitamin D levels could help lift your mood and improve your mental well-being. But first, talk to your doctor to see if a deficiency might be playing a role. Stay tuned for more warning signs. Your body might be sending you important signals. Sign 5. Impaired wound healing. Have you noticed that cuts, scrapes, or bruises take longer than usual to heal? Slow wound healing could be a sign that your body is running low on vitamin D. Vitamin D plays a key role in repairing and regenerating skin cells, and it also helps fight off infections that can slow down the healing process. When levels are too low, your body struggles to repair itself properly. Research has shown that vitamin D is essential for producing compounds that help form new skin during the healing process. For example, one study found that people with low vitamin D levels had slower healing rates after surgery compared to those with normal levels. Another study linked deficiency to chronic wounds, like ulcers, that just won't go away. If you've noticed that even small wounds take weeks to heal, it's worth checking your vitamin D levels. While other factors, like diabetes or poor circulation, can also affect healing, a deficiency might be making the problem worse. Getting enough vitamin D can help your body heal faster and more effectively. But first, you'll need to confirm your levels with a simple blood test. Stick around to learn more warning signs. Your body might be trying to tell you something important. Sign 6. Hair loss. Is your hair thinning or falling out more than usual? While hair loss can have many causes, one often overlooked reason could be a vitamin D deficiency. Vitamin D is crucial for keeping your hair follicles healthy and active. These tiny structures in your scalp are responsible for growing new hair, and when vitamin D levels are low, they can become weak or dormant, leading to hair loss. Research has shown a link between low vitamin D and certain types of hair loss, like alopecia areata, an autoimmune condition that causes patchy hair loss. One study found that people with alopecia often had much lower vitamin D levels compared to those without the condition. Another study suggested that supplementing with vitamin D could help improve hair growth in some cases. If you've noticed more hair in your brush or on your pillow, it's worth considering whether vitamin D could be a factor. While stress, genetics, and other health issues can also cause hair loss, a deficiency might be making it worse. The good news: boosting your vitamin D levels could help strengthen your hair follicles and promote healthier growth. But first, talk to your doctor to see if a deficiency might be playing a role. Stay tuned for more warning signs. Your body might be sending you important signals. Sign 7. Muscle weakness or pain. Do your muscles feel weak, achy, or crampy, even when you haven't overworked them? This could be a sign that your body needs more vitamin D. Vitamin D is essential for muscle function. It helps your muscles contract, move, and stay strong. When levels are low, you might notice weakness, pain, or even frequent cramps, especially in your legs or back. Studies have shown a clear link between low vitamin D and muscle problems. For example, one study found that people with vitamin D deficiency were more likely to experience muscle pain and weakness compared to those with normal levels. Another study suggested that supplementing with vitamin D could help improve muscle strength, especially in older adults who are at higher risk of deficiency. If you've been feeling weaker than usual or dealing with unexplained muscle pain, it's worth checking your vitamin D levels. While other factors, like dehydration or overexertion, can also cause muscle issues, a deficiency might be making things worse. The good news: getting enough vitamin D can help your muscles function better and reduce pain over time. But first, you'll need to confirm your levels with a simple blood test. Stick around to learn more warning signs. Your body might be trying to tell you something important. Sign 8: bone loss. Have you been told you have low bone density or experience fractures more easily than expected? This could be a red flag for vitamin D deficiency. Vitamin D is essential for helping your body absorb calcium, the mineral that keeps your bones strong and dense. Without enough vitamin D, your bones can become weak and brittle, increasing the risk of fractures and conditions like osteoporosis. Research has shown that people with low vitamin D levels are more likely to experience bone loss. For example, one study found that older adults with vitamin D deficiency had a higher risk of hip fractures. Another study linked low vitamin D to lower bone density in younger adults, showing that this issue isn't just for older people. If you've been diagnosed with osteopenia, early bone loss, or osteoporosis, or if you've had unexpected fractures, it's worth checking your vitamin D levels. While aging and genetics play a role in bone health, a deficiency could be speeding up bone loss. The good news: boosting your vitamin D levels, along with calcium intake, can help strengthen your bones and reduce the risk of fractures. But first, talk to your doctor to see if a deficiency might be contributing to the problem. Stay tuned for the final warning sign. It might surprise you. Sign 9: persistent digestive issues. Do you struggle with ongoing digestive problems like bloating, stomach pain, or irregular bowel movements? While these issues can have many causes, they might also be linked to low vitamin D levels. Vitamin D is absorbed in the gut, and conditions like Crohn's disease, celiac disease, or irritable bowel syndrome, IBS, can interfere with this process, leading to a deficiency. Research has shown that people with digestive disorders often have lower vitamin D levels. For example, one study found that individuals with Crohn's disease were more likely to be deficient in vitamin D compared to those without the condition. Another study suggested that low vitamin D could worsen symptoms of IBS, like cramping and discomfort. If you've been dealing with chronic digestive issues, it's worth considering whether vitamin D could be a factor. While diet, stress, and other health conditions can also play a role, a deficiency might be making your symptoms worse. The good news: addressing a vitamin D deficiency could help improve your gut health and reduce discomfort. But first, you'll need to confirm your levels with a simple blood test. Stick around for the next section, where we'll talk about what to do if you suspect a deficiency. It's easier to fix than you might think. What to do if you suspect a vitamin D deficiency. If you've noticed any of the warning signs we've discussed, the first step is to check your vitamin D levels. A simple blood test called the 25-hydroxyvitamin D test can tell you if you're deficient. Most experts recommend aiming for a level between 30 and 100 ml for optimal health. Once you know your levels, you can take steps to boost them. The best source of vitamin D is sunlight. Just 10 to 30 minutes of sun exposure a few times a week can help your body produce enough. But if you live in a cloudy area or spend most of your time indoors, you might need to rely on other sources. Foods like fatty fish, salmon, mackerel, egg yolks, and fortified products, milk, cereal, can help. However, it's often hard to get enough vitamin D from food alone, so your doctor might recommend a supplement. The typical dose is 600 to 800 IU per day, but some people may need more depending on their levels. Finally, make small lifestyle changes, like spending more time outdoors or eating a balanced diet. Remember, it's always best to work with your doctor to create a plan that's right for you. Stick around for the conclusion, where we'll recap everything and give you a final call to action. Let's quickly recap the 9 warning signs of a vitamin D deficiency. Constant fatigue, frequent illness, bone and back pain, depression or mood swings, slow wound healing, hair loss, muscle weakness, bone loss, and persistent digestive issues. If you've noticed any of these symptoms, it's worth checking your vitamin D levels. It could be the key to feeling better. Vitamin D is essential for so many parts of your health, from your bones and muscles to your immune system and mood. Ignoring a deficiency can lead to bigger problems down the road, but the good news is that it's usually easy to fix with sunlight, food, or supplements. If you found this video helpful, give it a thumbs up and share it with someone who might need it. Don't forget to subscribe and hit the notification bell so you never miss out on tips to keep your health on track. Taking care of your body starts with listening to it, and now you know what to look for. Thanks for watching, and remember, your health is worth it.